This segment of Delmarva Life is brought to you by Peninsula Home Care.
You know, we talk a lot on Delmarva Life, and today we're talking about talking, specifically losing the ability to talk. It happens every day, whether it's from an accident, an injury, surgery, or any other health condition. And that's where people like Karen Musengwa come in. She is a language pathologist and certified dementia practitioner with Peninsula Home Care. Thank you for being here this afternoon. I want to talk a little bit about what you do. You're a language pathologist. What type of patients do you treat and what conditions?
So as a speech language pathologist, we work with people who do have communication deficits. Our title is very deceiving, so yes, we help people with their talking and communicating and their voice, but we also work with people who have difficulty swallowing and also cognitive deficits, which is the functioning of the brain.
So a lot of people associate dementia with memory loss, but it's more than that. It's like you say, the deficient brain. How can speech therapy help?
So as a speech pathologist, we are trained in the functioning of the brain. And so what we do is when we receive a doctor's order, we would go in and do a formal standardized test. So we would assess each person to see where they fall on the spectrum. So it could be mild, it could be in the beginning stages, moderate in the middle stages, or late at the end stages. So we determine where they are in the disease process and then create an individual plan specifically for that person and create goals to encompass their specific needs.
Being a caregiver to somebody who has dementia can be pretty stressful. Do you have any suggestions for other dementia caregivers?
Yes, caregiving, that's a great question because caregiver burnout is huge. Caregivers are in fact becoming more sick oftentimes than their loved ones, and then they can't take care of their loved ones. Then they're living a life in pain and hurt and dealing with their own disease process themselves. There's 4 things that I do recommend for caregivers. The first one is self-care. You have to take care of yourself. It's so hard to do, but it's critical. If you're not taking care of yourself, you cannot adequately take care of your loved one. The next thing is being able to ask for help. Again, another hard thing to do is we don't want to ask for help oftentimes, but it is a necessity. It has to happen. You can't do it alone. So whether that's with your family or your community, your church group, there's resources in the community that you can ask for help. Next is focusing on what your loved one can do rather than what they can't do. They still have abilities. So with dementia, oftentimes we think of what they can't do and what they've lost, but you want to really focus in on what are their strengths. Hone in on their strengths and really celebrate the successes. And lastly is there are going to be days where you're feeling down and you just feel like you can't go on. And hopefully those are only happening occasionally. The grief process is real. You're losing someone that you loved, and it's a long process. So it's okay to have those moments where you're not feeling all into it. But the really important thing is that when you feel like it's something becoming chronic, where it's every day you're feeling depressed or angry, at that point you need to seek help.
It's very important.
Very important.
Yeah, you can't do it yourself. So in addition to being a dementia practitioner, you're also a certified health coach. So how do you work that into your daily routine with patients?
So as a health coach, I do this separately from my speech pathology, and I work with people who are trying to age without chronic disease, without getting the cognitive deficits. So there's some things that we can do to keep our brains healthy. And so the first thing is cutting out the processed foods. So we're surrounded by junk food, we're surrounded by processed foods. So eliminating those foods and focusing on a whole foods diet rather than the processed foods is incredible for the brain. Next is exercise. Exercise is actually a wonder drug for the brain. It creates new neurons. It's this thing called neurogenesis, where new neurons actually are created, where with dementia, neurons are dying, but exercise can actually grow the brain. It's incredible. Another thing is just decreasing stress. Decreasing stress is so important. Hard to do. But very, very important. Making sure that you're managing your stress. It's going to happen. It's not going to go away. but you have to manage that stress. And trying to cut out some toxins that may be in your environment. So we are surrounded by tons of chemicals, which can come in our food, our healthcare products. We could be around toxic people.
Sure.
So eliminating some toxins. And lastly is sleep. So getting adequate amounts of sleep. 7 to 9 hours, and too little sleep is just as bad as too much sleep.
Sure.
So you want to find that happy spot for you, whatever works best for you within that time frame, 7 to 9 hours.
Some important information.
Yes.
It sounds so simple, but sometimes it's hard to do.
Yeah.
Thank you so much, Karen
Thank
Musingwa
you.
with Peninsula Home Care.